also can have some viral infections, but the most common causes are bacterial infections. And in the layman's language, you call them bacterial infections of the bone or infections of the bone, but in the medical term, we call it osteomyelitis. This osteomyelitis...
Indeed, that is medical.
Yes, that's the medical term. It's called osteomyelitis. And when you walk around the wards on orthopedic trauma ward and you hear someone saying we have an osteomyelitis case, it means they're talking about bone infection. And it is a two-way thing, osteomyelitis. It is divided into acute osteomyelitis and chronic osteomyelitis. Or you can just say acute bone infection and a chronic bone infection. And the two differ.
Okay.
If you look at acute bone infection, this one, it has mild symptoms. For example, you can have mild deep pain in the bone. We can have some mild fevers. We can have some mild inability to use the limb mildly, and some slight increase of fevers and swelling around a given part of the bone. We should note that if the infection is in the bone, we call it osteomyelitis, but at times this infection can also be in the joint. Still, the joint is made up of bones, but if it is specifically in the joints, for example, if it is in the knee joint, or if it is in a hip joint and so on, it is called septic arthritis. It becomes septic arthritis. That is an infection in the joint. But if it is in the bone and does not cross to the joint, is when we qualify it to be osteomyelitis. So I was talking about the acute one, which has mild symptoms. And if this acute one is not treated, like you mentioned in the preamble, it can progress. And in its progression, it can become chronic osteomyelitis. And this one, most of the times, patients report on ward with chronic osteomyelitis because it is very difficult to diagnose the acute one, especially in these low-developed countries like our country here. It is very hard. So whenever they come, and the chronic one is characterized by one, they'll have pain. This time it will be moderate to severe pain. They will come with sometimes joint stiffness. They will come with inability to use the limb pains. They can come with short limbs. I will explain why. They can come with wounds, and they can come with discharging wounds at a given part of the bone. Yes, and also increased temperatures, and some report even with sepsis already that is taking place, and that is chronic. It means this bone has been infected and has started bringing out those discharges and so on. Yes, that is chronic osteomyelitis. So I now think all of us have understood this part of what is the bone infection, their types. Yes.
Now looking at these, because when you were giving us the difference between the acute and the chronic, some of the symptoms seem to be a little closer to the other, and so sometimes you might never know. But let us first of all look at the causes of some of these infections. How do my bones get infected in the first place? Because the bones are inside, they are covered. So how do they get infected?
Exactly.
Hey.
I didn't mention about the problem of osteomyelitis. You understand that almost in we receive around 100 we received around 100 cases of osteomyelitis in around 100,000 cases of orthopedic or clinical cases that appear in hospitals. But I'll be specific in Uganda here. In Uganda here, almost 10% of the patients that report to the orthopedic wards come with osteomyelitis. So you can imagine the burden is 10%. And you realize that almost a third of that population that has come with osteomyelitis is children who are aged between 10 to 14 years. I will still explain why. So that is the burden of osteomyelitis. Now, taking you back to your question, which was about how does this infection get to the bone? We see our bone is covered by the muscles. It is covered by everything. Someone is even fat and so on. One, there are around 4 ways into which these infections reach the bones. The first one is what we call the hematogenous route, or in common language, it's through blood. Someone can get, and this is especially in the children, they can get slight infections, maybe it's a bacteremia and so on, and then it's not treated well, and these germs or these bacteria, organisms, in one way or the other, get themselves into, through the bloodstream, they get themselves into the bone. You should understand that the bone also is supplied. It is vascularized. It is supplied with blood and also has nerves. So as blood is moving over the body, it can still reach the what? The bones. So once it reaches the bones, these bacteria there can easily get trapped into there and they will cause this infection. That is one. Two, it can come from surrounding tissues. For example, if you have maybe an infection around the muscle, for example, or even at the skin, like cellulitis, inflammation around the skin, or if not, these people have diabetic foot. Yes, this infection can find its way from the skin or from the muscles, then that's how it can enter into the bone. The third way in which this infection can reach into the bone, when people get open fractures or open injuries. So once you get an open injury, the bone is broken at its outside. So maybe you're on the roadside and so on, and these germs can easily get access into the bone. So as they are closing the bone, maybe to heal it and so on, to treat it, the germs can still be inside that bone and they will start their infection right away. And the last way, this one now it is on our side as the medics, maybe it is through these what we call implants. At times, due to certain factors here and there, maybe someone as they're operating, maybe in theater or surgery, maybe the implant can easily be affected, and when it is infected and put into the bone, this bone can easily also get what? Infected. And those are some of the 5 routes that I've tried to explain, into which these microorganisms or the bacteria can reach into our bones, and in a simple way.
And when you look at all these ways, sometimes you realize that someone might not have a lot of control over them. Like seriously. But still talking about this, let's look at while you were talking about while you were talking about this problem and the real problem and how it is, you particularly referred to a particular age group. On the contrary, some of us think that any bone-associated issue is for the aged. But when you talk about that, mostly in the young, in the young people of 8 by 10, this is fresh. Your bones are still fresh. How do you get infections? Why? Even the young people. Because for us, we think, and you know, I think it is because our elders, our grandparents, have created that in us, that at around 45, your bones start having issues, and then you need a walker or a stand or something to support you, and you know. So when someone holds something to support them, when they are 30,
exactly.
But why in the young people instead of the other age we thought?
Yes. Now, if you look at this condition, osteomyelitis, it is not a degenerative condition. Degenerative, these are conditions that come with time and they come with age. In the next maybe episodes, we shall talk about some of those, like osteoarthritis, like lumbar spondylosis. No. For it's not degenerative. It's something that can happen. That's why we talked about acute. Acute is something that happens immediately. And why the children, or why this age?
Yes.
When I was talking about the routes into which these microorganisms or the bacteria can get their way into the bone, I talked about the hematogenous route, which is maybe through blood. And you find that these babies or these children, at times we tend to diagnose them ourselves, and also when they report with fevers, we tend to ignore other factors, and we think maybe it is malaria and so on, and we leave out these other parts, so that those infections stay in there and can easily get into the bone. Secondly, the bones of these children are still brittle, or they are still weak, they are still growing, so it means they are not as hard or as strong as adults. You realize that it's very hard for someone to get osteomyelitis, that maybe unless they have got an accident and they get an open fracture, unless they have undergone a surgery, it is very hard for someone who is old enough to just get osteomyelitis out of the blue. But for the children, it is very easy to get them because the bone has different parts. I will not take you to the deep anatomy, but we have what we call the epiphyseal lines, and those ones, or the epiphyseal plates, those are the growth plates into the bone. And when you take an X-ray, you usually look at those growth plates. And now, these bacteria, always get their way through from the bone, maybe from, I'll call it the bone head, that's how you understand it, to the metaphysis, that is where you see that long bone.
Yes.
This disease likes the long bones a lot, and it is easy for them to access such. And what they will do, they will destroy that growth plate, and that's how we come out with these short limbs. Find someone with a short limb and they are limping. Yes, we shall look at it in the clinical picture or in the signs and symptoms of such. Yes, some will report with short limbs. So these children, why children? One, they have very weak bones. Their bones are still growing, so germs can easily access them. And secondly, they usually have their immunity is still also growing. So these microorganisms, or they are immune suppressed sometimes, so the microorganisms can easily find their way into the bone through blood and they get infected, which is not the case for all people, where our immunity at least sometimes has developed and so on. So it is really between the children that we see most of these cases. For the adult cases, it will now fall the other routes of surgery, open fracture, or implants. Yes.
Now, since we want to go to the signs and symptoms, so that we can really get to the real understanding of what exactly happened, so that I can know. Because I mean, there are a lot of, someone can walk for a long distance, and then when they get issues with their legs, they say, I think I have a bone infection, according to what I feel, the heat, let us talk about the specific symptoms that are associated with these infections.
These infections, one, like any other infections, the first thing they will be associated with some increased temperatures. It depends if they are acute or they are chronic. For the acute, we talked about having mild increased fevers. We can talk about pain. And this pain, most times it is deep pain. If someone doesn't feel pain on top, you don't feel pain on top of the body, but you feel deep pain in the bone, they will report with that. Some others will come with swellings, and some others will come with discharging wounds. Those discharging wounds are most common in chronic osteomyelitis, because how this bone is infected is that I'll talk about how the disease comes about. The disease comes about by these germs coming into the body. Once they come into the body, they will destroy what we call bone. They call what we call bone destruction. They destroy the cells of the bone, and in so doing, they will also inhibit or block or destabilize blood supply to the bone. So once the blood is decreased blood supply to the bone is destroyed. It becomes very brittle. And once brittle means something that can easily break. And once they become destroyed, still, we shall have pus formation within a given compartment of the bone. And once we have pus formation, that pus will increase the pressures within that given bone part, and we shall destroy the epiphyseal lines and so on. And now this pus wants to find its way out of the bone. And in so doing, that's how it will increase. And remember, our bone is already damaged, so it becomes soft. And in so doing, the pus increase, the pressure within the bone is increasing. So this pus wants to get its way out, and that's how we get those discharging sinuses. And those are clinical or real signs, or what we call the ideal signs of chronic osteomyelitis. Once we have those discharging sinuses, once we have those discharging wounds that bring out pus non-stop, and they are coming direct from the bone most of the times, that is what we call osteomyelitis. And in most cases, it is hard to diagnose, especially in the early stages, because I told you, there are mild fevers you will see. It is mild pain someone will feel. So, in our clinical setting, or in our country like this, always, we normally, most of the times, we receive almost 80% of these cases, we receive them when they are already in the chronic stage. Someone now is feeling a lot of pain, they are having the discharging, and so on. So
it's a norm. You feel the pain, you get some painkillers, then you get some relief.
Yes, you think this is malaria, and so on and so forth. You misdiagnose it, and at the end of the day, you're coming with this disease. And what I can tell you, this is a chronic condition. Once the bone is infected, it is infected. We are not going back. And yes, when I was telling you about the topic today, it is a silent killer, and it's a silent cause of disability. Many of the amputations that people have been cut off limbs that are in the country right now, most of them are due to osteomyelitis, especially at young age. A child reports with a very simple fracture, but it is badly managed, and they end up with osteomyelitis, and the bone, you have to undergo various surgeries. Every time you undergo various surgeries, what we call sequestrostomy, how we remove out this dead bone from the maybe from the living bone. So you undergo various surgeries, and at times, if you don't have capacity, most of the times you end up amputating this limb, and you have what we call complete life disability. So that is how bad osteomyelitis can be, and those are some of the clinical pictures that we have seen for osteomyelitis, how it can present in these people.
Still, as we look at because it now raises a lot of concern. Still, as we look at the symptoms, someone would want to have an early diagnosis. So, like for example, when people are doing maybe a full body checkup, is there a way you can check and see whether my bones don't have any of these, or if I present with some of these primary symptoms like fever and all that, the temperatures and all that, when I come, what should I tell? For example, I come to an orthopedic center. What should I tell you that you're diagnosing, if as a layperson coming to this facility?
Exactly. Now, I will first give you something about which people are at a risk of getting this osteomyelitis. Not everyone is at high risk, but I'll look at who at risk. One, children 10 to almost around 18-20 years, especially those people at a higher risk of getting osteomyelitis because of what I explained about their bones and so on. 2, immune suppressed people or patients. What do I mean by immune suppressed? People have a low immunity. For example, people who are living with diabetes, people are living with maybe hypertension, people are living with maybe HIV and so on. They're immune suppressed. So with low immunity, these bacteria, anywhere, you can eat them through food, or you can get them anywhere, and they find their way into the bone. Thirdly, people who are living with score cells are also at a higher risk of getting this osteomyelitis because already their blood supply is compromised. So once this infection gets its way into the bone, it easily affects them. Fourth is people who have undergone surgeries and they have wounds. Once you have
any surgery?
wound, yes, any surgery, it can be any surgery, and maybe the wound may become septic, especially if you don't clean it, if you don't take wound care, very good wound care. The germs or the microorganisms can find their way into the blood and can get into the bone. Then the fourth maybe is people with implants are also at a risk of getting this osteomyelitis. So back to your question about how to diagnose it.
Yes.
What can I do? There are various ways and various investigations that we do, especially. But I can take you into one of the investigations. We can do what we call the lab investigations, laboratory. The laboratory shall do a complete blood count, the CBC. We can do ESR. We can do various things. These clinical people know about them. I'll not tell you to go and tell them. But once you arrive, they will know what exact investigation to the laboratory. Then we also do an X-ray. Normally diagnose it on an X-ray, this osteomyelitis, for us to know how it looks, how an X-ray of a patient who has osteomyelitis looks and how a normal one looks. So they will do. But that one, you can't just walk in and tell us I want to do an X-ray. You must have the symptoms, because at least for the lab we can do for general checkup. But now these other ones I'm going into, for them we do them specifically, especially if basing on our history or examination as medical people, we see that you require or you have or we have an impression that you might be having osteomyelitis. We can do an X-ray. We can do a CT scan. We can do an MRI still. All those investigations can be done to come up with the diagnosis of osteomyelitis. Unless maybe in the blood that I forgot to talk about, you can do blood culture and so on. So the medical people know how to investigate this. So what do you do? What brings you to the hospital? Actually,
we are going to start from there shortly after the break, because this is very important and very scary. I mean, who wants to lose their limb simply because of something that you would rather have have prevented. So we are coming back shortly. Stick with us as we continue with the conversation. Welcome back from the break. This is Family Hour, empowering families one episode at a time. But of course today we're looking at bone infections, and before the break we had gone through a number of things, including the signs and symptoms, and why it's important for you to do a body checkup, and of course the procedures. But there is something you were raising when I cut you short because we had to break a bit, and I want us to pick it up from there. Yes,
I think before we wait for the break, I was telling you about what you should do.
Yes, when I enter a facility.
Yes, in a facility, or what you should do to in a kind of way of prevention. In my case, I actually, in the causes, I forgot to mention about this other cause, which is what we call antibiotic resistance. Antibiotic resistance, in simple terms, is that someone takes antibiotics, or they take medicine, and this medicine cannot work on the infection they have. And how it comes about is that once these organisms or the bacteria become used to that given drug someone is using. And how does that happen? Is someone using maybe that drug without a prescription. You feel a fever, you feel something, you take a given, I will not mention some antibiotics here, maybe. Yes. Well, someone feels anything, but you all know which antibiotics you people take. You have a stomachache, you know what you take. Give me Fragile. You
even dictate when the pharmacist tries to change. For me, I want the other one.
Give me this given one.
It's the other one that works on me.
Yes, I feel I have an give me safe. Give me this. You dictate for these medical people. You continuously use it even when it's not supposed to be used. And now you get what we call microbial resistance. And what happens is that the germs or the organisms become used to that given drug. And other times it can be because someone is maybe you take half dose, people don't complete their doses, and so on. And now, how is that related to osteomyelitis that we're talking about? Once the germs or once the infection, once the microorganisms become resistant to the given antibiotic someone uses, you'll find that you get an infection, you take the given antibiotic someone is supposed to be given, and they don't work. And the overload, we get an overload of this bacteria into the bloodstream, and that's how they can end up into the bones and cause that given osteomyelitis. So what we tell our people is, one, avoid self-medication. Avoid taking antibiotics when you're not supposed to take them. Unless they are prescribed, please take them when you're prescribed. Don't take them because you feel you must take them. These days we have a challenge of AI. It is a very good and a disadvantage at the same time. People will just type in what they feel, and they will ask, what drugs can I take? Of course, even I, most of the times you tell you visit your clinical officer, but it will give you other details down here. So people find they're using
actually
Google.
Visiting the clinical officer comes last.
They first give you the information because they don't know who they're talking to at the end of the day. So avoid self-medication. Secondly, in children, treat these fevers. Give them the exact attention they deserve. Whenever you say child with fever, don't take it lightly. You say child with a given swelling at a given part of the bone, at the thigh, at the leg, here maybe on the hand, don't take it lightly, that swelling. Once you have pain on a given part of the body, don't also take it slightly. Always visit the medical centers. Once you have an open fracture, or once you have an open injury, and you're supposed to do wound caring, please do it aggressively and do it well, so that these wounds are clean, they don't become septic, and at the end of the day end up spreading the germs or the microorganisms to the other nearing parts, and that's how they'll end up into the bones. Yes, also these people have undergone surgery. Make sure you take the medication as it is given to you in full doses, so that you don't get these germs finding their way into the bone. Like I mentioned, once the bone is infected, it will never go back. You will undergo multiple surgery. The discharging can stop, the sinuses can go away, but you remain with disabilities, you remain with those wounds. And in time, they can always keep on coming. It can stop for 3 years, 4 years, it comes again. Because once the bones are, once the germs are trapped into the bone, it's very hard for them to get out. They keep on destroying, and see, when it becomes worse, that's when we come to amputations, taking off the limb. That's when we come to disabilities. Someone will have short limbs, they'll start limping. That's when we have sepsis can even occur. And in the long run, even if you don't treat it that well, it can still be a cause of death in this given society of ours.
Okay.
Yes.
Maybe I think the short limbs becomes so catchy in this, and someone would really want to see the chemistry that happens, that if I have, for example, my 2 legs, and then at the same size, and then at what point and what happens really to see that the other one shortens. How does it all happen?
Yes, like I talked about this thing happening most in the children. And remember when I was discussing, I talked about epiphyseal plates or the growth plates in these given bones. So you find that osteomyelitis may attack this given bone, the hip joint, and the epiphyseal line of these children. Actually, most of the time the epiphyseal plate closes or is fused at around 21 years, 20. So below that, it is someone is still growing. That's why it's very hard for you to grow and become taller at the beyond 21 years or 22. It is very hard. You always get your maximum height at that given age. So now for these children, they are still growing. So it may affect a given part of the hip, maybe for example here or here, and you'll destroy that growth plate. Find that this one is normal, it will grow normally, and this limb will become longer. But this limb which is affected will remain shorter. So that's how the short limbs come about, is that these germs or the infection destroys or acts at where someone's growth is supposed to take place. So once it does not take place at that given point, there's no way that person is going to grow. The bone is going to grow longer. So you find that we have that inconsistency where one bone will grow normally and this other one will grow shorter, and you end up with those short limbs.
Well, the other thing is, of course, I don't know in which category this falls, whether it is self-medication or what, but there is some information out there that people have, that, for example, when you have any issue with your bones, especially with the legs, don't worry. just walk barefooted on a rough surface, and then you'll get relief because that rough surface will massage your whatever your I don't know, the muscles or what, and then you will get relief. Is there any way this is biologically proven, especially in managing some of these conditions?
There are a lot of myths. I'll call them myths. Those are unverified stories out there. Some true, some untrue. But I'll be specific in this case you have asked. Walking on barefoot or doing whatever you can do. Actually, sometimes we advise this walking on barefoot to increase the sensitivity and so on. And that is in given specific cases. You should know why someone was told to walk on barefoot. Don't just see someone walking on barefoot and you copy. Because we have received people, they have a diabetic foot, their immunity is already compromised, they are walking barefoot and they will get a wound and that wound will not heal. And then we shall end up cutting off that given limb. So before you do anything, engage your clinicians or your doctors, because whatever we tell you has been proved and has been experimented, and it works. Now for this given case of osteomyelitis, whether you walk on barefoot from here up to Germany or Egypt, there's nothing you're going to get at the end of the day. This is an infection that is inside the bone. So you walking barefoot and so on will have no issue, no effect on this given condition. So you understand what given condition someone has been asked to do what.
I don't just copy.
Yes, I told people to do exercises, and someone do exercise. But if there's some condition, shall tell you don't do exercises. Please rest. Don't carry heavy things. Don't do gym. And for you, because you think for someone to have a healthy body, I must do gym, you end up with back problems. And we are treating most of those people who do it without advice. You just do any given activity, you end up with spondylosis, arthritis, and you come to treat that because you have not done it in a guided way. So everything has its guided way, and it has advantages, and what's done in excess, it will cause issues. So for what we are discussing about today, the management, I think we can drive right away to the management.
Yes.
Its management is typically clinical. And what do I mean by clinical? It is mostly done by the clinicians. How we manage it is, since it is an infection, once it is acute, always what we first do is manage with antibiotics. We shall give IV antibiotics through the veins and so on. We shall do, after us doing those tests that I talked about, the x-rays and so on, we shall give these antibiotics, we shall give these painkillers and so on, and we shall monitor. We shall give various knowledge that someone is supposed to do. Of course, we shall have resting the limb within there. Someone will not be able to use that limb in a given time, and we can rest it in various ways. Either we can choose to give you a crutch, we can choose to give you a cast, we can choose to just tell you to lay in bed and rest just generally there. We can choose to tell you whatever way we want you to rest the limb, because we need the bone to heal, of course, at the end of the day. Yes, after that is in acute ones. So we get it in acute, and we clear those germs. We can prevent it from becoming chronic. But I told you it is very hard. Why? Because of our health setting and so on. People
and our mindset as
Ugandans. People come in the hospital when they are sick. You'll never grab someone from their home to come and do a medical checkup. It's very hard. Come and do it for what? And that's why whenever they come, we find something.
Actually, others will say, you keep on going for checkups, but one day you'll get what you're looking for.
And at the end of the day, what you're looking for, these checkups will give us things when they are starting. And it's very easy to treat something once it is starting. You've gone to Cancer Institute and you have seen these patients who report with stage 4. And the best we can tell you is that, please, we're going to just manage you there, decrease your pain, but we can't do nothing. Those are people, they tell you have 2 days to die, you have 4 days, and you say, how are these people estimating someone's life? Because you come and do tests and you're like, where do we start from? But once you come in the early days, it is easy for us to say, something is starting up in your prostate, something is starting up in your back, something is starting up in your bone. Let us do this early enough and we can handle. So I was talking about that acute part where we use those drugs and we can sometimes eliminate this. Now we look at the chronic part of it. For the chronic part of it, in addition to drugs, and this rest we talked about, at times it will not be enough. We shall need to go for the surgery. We shall need to take out the dead bone, and that's that's what we call sequestration. We take out the dead bone, because once it still remains there, this pus will never stop coming out. So we have to drill into the bone, take out the dead bone, take out all the pus, then give you drugs and cover up. So you find that if someone gets chronic osteomyelitis, they almost undergo the surgeries. Most of the times, you can undergo this one. That were this may be a given sinus stops, bring out pus. After 2 years or 6 months, another one is bringing up pus, maybe on a given other part of the bone. So we have to again drill and take out. At times, it may become hard, or it may become aggressive, in that someone will report with what we call a pathological fracture. A pathological fracture, this is someone who gets a fracture when they have not got an accident. Someone is just walking and their bone breaks because it has been destroyed and by this bacteria or the infection. So that's when they need to go undergo surgery. And once it becomes worse, at times when you need to take out a given, maybe it has eaten almost 75% of this bone, I mean, we can save none. We have little to save. Even if we go into surgery, we can, once we remove out 75, you cannot stay with the 25 and you still do normal activity. That's when we go to things like amputation, cutting off the limb at a given part of the bone. And that's how nasty and deadly it can be. So we always tell these people to watch out. Once you have got an open fracture, please, once they are given these drugs, take them accordingly. Once they have told you, please always come back, we nurse this wound. Don't take it lightly. I will not leave here without talking about bone setters. You've heard of them. Yes, how they do this and so on. And we have reported so many cases of osteomyelitis that come out because of bone setting, because they use given things. Someone has an open fracture, they're applying various medicines and so on. They're applying cow dung.
And now they get a brick, put it in a polythene, and use it to align the bone. Exactly.
They are not doing it the aseptic way. They are not sterilizing what they are using. Everything is already infected. So they are adding on more infections on given infections. And once someone now heals with their osteomyelitis, they have nothing to do rather than sending them to us. Because someone has an open fracture, they have a wound there, and what you're doing, you're adding various materials, put these other drugs, I don't know where they get them from. You get? And at the end of the day, you're increasing on the load of these bacteria and so on. So we always tell these people, go to the right medical facilities. Once you get fractures, once you get open wounds, don't take them lightly. Don't just get anything, any herbs you get out there. Now put this, because you're saying from Chana Mukaka has come and said, someone got a fracture and we put this. Also you put this.
And it helped them
very well and blah, 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 blah. At the end of the day, you'll get this infection. And once we tell the people, once the bone is infected, it is a done case. It's just like cancer. Once you have cancer, okay, we've seen some that are treatable in some given stages, but once you get some once it advances to some stages, there's nothing we can do. Now for chronic osteomyelitis, there's nothing typically we can do except doing these various surgeries, and at the end of the day, you'll end up with it can even move. You find that it started with maybe this bone from down here. It goes on, the infection goes on moving. It can even reach this joint, and we need now to cut off the hand. It can still move and so on, because these are germs and they are moving. They are going on destroying this bone and so on. So in chronic, we usually do the surgeries. We usually do also what we call resting, and after amputation you can always give these people given orthotics and prosthetics to carry on with their life and activities and so on. So that's how deadly it is, this osteomyelitis, and it's a silent one, because in its early stages it is very mild. and hard to detect. But in the later stages, once it comes out, then it becomes again very vigorous and very dangerous. Yes.
What message do you have for someone watching us, especially because this is a very serious condition? And you know, when you talked about bone setters, I remember the scenario where someone is in hospital under safe care, and then someone is busy persuading the relatives to take them out of hospital to a particular person out there, and then this person will tell them, first remove all the implants, and then, you know, but what message do you have for Ugandans, for someone who is watching us right now, especially about this condition and its severity?
Yes, this condition, don't play around it. Because at times you receive what you call closed fractures. And someone can meander and do lousy things around it. The bone will find its way and heal. You know, whatever way it has healed, it can heal deformed and so on.
But it will heal.
Yes, sometimes it will heal eventually with whatever way it has come out. But at times you have what you call open fractures. Open, I mean you have got a fracture and there is a wound. Other times not even just a fracture. You can get cellulitis. In cellulitis, I don't know whether in Luganda it's what we call a talo. Have you heard of a talo? Yeah. And when we get these people, they say, totukuba mpiso, blah, blah, blah.
Yes,
and so on and so on. Yes. And they end up dying in bed. They end up dying in bed most times because they have got an infection that is maybe a cellulitis infection somewhere. Temperatures are increasing. There is pus that is being generated, and they are saying, no, this is a traditional condition. It's not a medical condition. And that by the time you know this pus, because there are all the germs that are clogged within, they are finding their way into the bone, and this patient is going to report with osteomyelitis at the end of the day. Now, my message out there to Ugandans who are out there, these diseases you see and these conditions that I'm talking about, I'm not getting these things. I'm not the first person to talk about them, and it's not rocket science that I woke up one day and I got this idea. These are things that have been there, they have been studied, they have been experimented, and they have been proved, and they are treatable. And that's why we go to school and learn about them, and now we are out here to teach you about these things. It means there is, once we are studying a disease, we study its cause, blah blah, up to management and how to prevent it. So it means we have the technical knowledge, and these medics out there have the technical knowledge, and they know at what stage this fails and so on. And you find that these bone setters or people are working in close relationship with the medical facilities, most of them. Others, they steal patients from there, and others, after things have failed, they run patients to those facilities. We have got many. I personally have seen very many, because I happened to work in those rural areas where those people are staged. But my message out there is, please visit the correct facilities. Once you have anything to do with your life, once you have anything to do with your bones, go to the specific doctors, go to the medical facilities. They will run these investigations, and they will give you drugs that have been proved to deal exactly with that. Don't listen to this the words of various people. Yes, your Senga, your judge has said, okay, in the ancient times we had them work, okay, because we had no any other option. But the world is moving, and we have studied these things. So we have knowledge, technical knowledge on how to handle this given one. Because for us, we shall know which antibiotics to give. Especially someone may have resistance. Maybe this given antibiotic cannot work. I know which antibiotic to go to. I know which other one to go to. And I know once all fails, I can do a blood culture, or I can do a tissue, maybe fluid culture of that given pus. And I know what exact microorganisms are causing this osteomyelitis, so that I give drugs that are sensitive to that given one. And you'll heal at the end of the day. So don't be blindfolded. Don't be misguided. Once you get anything to do with your bone, the children especially, this one is a cry to the parents, because I told you it is most common in children, and we end up children having disabilities that they cannot explain. The child says, I don't know when I got this, but they tell me when I was young, I got a fracture, I fell from a tree, and I've been having these wounds coming they have done surgery and so on, because the parents were misguided and they ended up taking their child to places where they will not get healed from. So, to you, our parents, please, once your child gets any of those, we talked about the fevers, the swellings and so on, please visit and don't take the medical facilities and don't take them lightly. Do the due diligence and take them on, so that we avoid disability. It's very hard to live with a disability, by the way. That's why these days even we call them abled differently people, because there's a lot that comes with it. And you imagine if God has created with your normal legs and hands, how you end up with one of them being taken. It's very hard.
Sure. Well, thank you so much. And maybe your closing remark as
yes, as we wind up,
yeah.
My closing remarks is that osteomyelitis or bone infections are just like any other infections that should be treated promptly once we suspect them or once we have symptoms that lead us to them. The silent killer and the silent cause of disability in this nation. So to the government, we pray that this knowledge reaches out to those people in the rural, in the urban area, so that they can know exactly what this disease is and how it is hard to handle, both financially, mentally, and socially, when someone is disabled because of osteomyelitis and so on. So please do wound care, have a very good immunity, so feed well and so on, and take care. Whenever you feel a certain pain, don't take it lightly. Always visit a medical facility. I wish you well, and we are always available to give that given knowledge. Once you get any symptoms, please always reach out to us, and we shall give you the right information and the right ways how to handle. Have a good night, please.
Thank you so much, Fahad, and that your viewer. Thank you so much. Well, it was such an educative discussion and conversation, and if you've not learned anything, I believe you've learned at least a thing out of this entire engagement. Now we want to thank you so much. You started with us. We've come to the end of today's edition of Family Hour. Now tomorrow is a Wednesday, and of course every Wednesday we have the bottom line. The bottom line, of course, from 9 to 11 p.m. So kindly come through and watch the bottom line tomorrow as we discuss very important issues of national importance here at Church of Uganda Family TV. Edrine Mukalazi is my name. I've worked with Emma Humza, and from the entire team, we wish you a blessed night. See you again tomorrow.